RDaSH's commitment to quality and continual improvement is evident in everything it does, and some of those improvements are pretty groundbreaking. For example, this innovative booklet, which has been produced to encourage more learning disabled women in Doncaster to access cervical screening.
After last year's success with the breast screening booklet, we decided to continue that work and produce a cervical screening booklet, because we know that the uptake of women with learning disabilities accessing cervical screening is very, very low.
I think the booklet is a good idea. It makes women not to be scared.
Meeting the needs and concerns of service users is a top priority for RDaSH. At Amber Lodge, the Adult Learning Disability Unit in Doncaster, the service users themselves have been closely involved in the drawing up of a new set of standards which will give them more choice and control over their care packages.
Well, the dining experience was a service user involvement process where we got involved with the service users to find out what was important to them, and some of the key issues that came out was the choice, but also that the dining experience itself is not just about food or the quality of food, it's about the whole social experience itself. Staff have been approach to actually sit with the service users and eat their meals, which will make that dining experience so much more of a social experience.
It's been good. It's been more relaxed, but if the staff start eating with us, it'll be more relaxed, and I think the patients will enjoy it more as well.
For older people, looking back at their lives and reliving happy memories can be very therapeutic, which is why life books have been introduced on Rowan Ward at Rotherham General Hospital.
The life book allows us to engage with the service user and carer to look at the individual, their lives, their likes before the illness. It gives us an opportunity to deliver person-centred care and look at their well-being and personhood.
The beauty about the life book, as I see it, is that it enables the staff to see the history of the family and relate to that, particularly at the times when the patient is in one of the lucent moods, and bring back memories which helps them.
Just as those life books can only provide a snapshot of people's lives, so this DVD can only provide a very brief taste of all the initiatives and successes going on throughout the Trust. It would take hours to cover them all in detail. Like the fact that RDaSH has been ranked the best in the country for the accuracy of its data monitoring. Like the action plans that have been developed in adult mental health for delivering more same-sex accommodation and facilities, giving service users more privacy and greater dignity. When you've built a reputation for excellence and innovation, you've got to live up to it. So for RDaSH, there's no resting on its laurels. The Trust is always looking to the future, always moving forward. In Doncaster, new ways of delivering adult community mental health services have been developed after consultations with the local community. The new service model is built around 5 specialist teams. It's being introduced first in Doncaster, and in 2011 it will be rolled out into Rotherham and North Lincolnshire. Also new in Doncaster will be the provision of additional CAMS services following the award to RDaSH of a contract to provide Tier 2 and Tier 3 services to NHS Doncaster. There's a major modernisation project being planned for North Lincolnshire, which will dramatically improve services and facilities there.
The plans for modernisation in North Lincolnshire are being developed. What we're hoping to achieve through the modernisation is both a real improvement in the environmental provision for inpatient services for older people, as well as a real community focus to the services that we offer. We're expecting to be able to improve aspects of inpatient care around privacy and dignity, and to ensure people have an environment which is most likely to result in recovery.
And the next stages of the Rotherham modernisation project are underway this year at Swallownest Court, with the refurbishment of the Rehabilitation and Recovery Services accommodation, and the start of building work on the new psychiatric intensive care unit. This new building and the older people's mental health facility, which is under construction at the Rotherham General Hospital site, has been designed with the environment very much in mind.
This year the Trust has entered into the Phase 5 of the NHS Carbon Management Programme in partnership with the Carbon Trust, and we'll be setting targets of 25% carbon reduction over the next 5 years. And then future targets after that will be to look at low carbon buildings for the Trust to achieve future targets.
As well as a new building here at Swallow Nest Court, the Trust has planted lots of new trees. This will form part of a half-acre woodland belt, a new green initiative called NHS Forest. 1,000 trees have been planted at the St Catherine's site, with more planned for the future, as well as the creation of new woodland walkways. There's so much happening throughout the Trust. New buildings, new facilities, new initiatives, new and better ways of doing things. It would take hours to cover them all in detail. If you would like more information about the things we've looked at in this DVD, you'll find it in the RDaSH annual report. Or take a look at the website. Whichever you choose, you can't fail to be impressed by the Trust's achievements, its dedication and its commitment to providing the best possible services in the field of mental health and learning disability.